I never could have continued to work as a pediatrician without the knowledge that I could have done something and I didn't do something. My name is Mona Hanna-Attisha. I'm a pediatrician and a professor with Michigan State University in Flint, Michigan. So it's been about 10 years since the start of the Flint water crisis. The Flint water crisis happened in April of 2014. That's when the fateful decision was made to press a button that changed our water source from the Great Lakes to the local Flint River without proper treatment. Right away, there was problems, and patients were coming to me as a pediatrician in Flint with concerns about water odor and quality and taste and rashes and hair loss and all kinds of problems with the water. And for about a year and a half as a pediatrician in Flint, I was telling my patients that everything was okay because like, how could it not be okay? Like, hello, like we live in America. This is the richest country in the history of the world. Flint is in the middle of the Great Lakes, which is the largest source of fresh water in the world. So I was telling my patients the water was okay because everybody in charge was saying that the water was okay. And that all changed for me when I heard about the possibility of lead being in the water. And that's literally the moment my life changed. Lead is a potent, irreversible neurotoxin. It alters cognition, it twists behavior. It can literally, change the life course of not just a child, but a population of children. So from the moment of hearing about the possibility of lead in the water, my work shifted. I did the research that showed that the blood lead levels of children increased after the water switch, shared that research very publicly, which was an academic no-no. You're supposed to go through something called the peer review process, but that takes time. And every day that went by was a day that our kids weren't in harm's way. I never considered myself a whistleblower before this. I just thought I was just doing my job as a pediatrician. But when all the backlash happened, when folks were calling me an unfortunate researcher, that I was causing near hysteria, that I was splicing, dicing numbers, it's hard not to feel this big. It's hard not to feel defeated and intimidated. And then you also kind of begin to second guess yourself. I think a lot of women especially develop the sense of imposter syndrome. Like, well, maybe I'm not an expert. Maybe I'm not good enough. Maybe somebody else should have done this. Maybe I should have kept my eyes closed and gone about my busy business. Like, who am I? I am a barely 5 foot tall, brown immigrant woman going against some of the most powerful forces in our state and our nation. I love to share that story because I love to remind folks that every single one of us, all of us, no matter who we are and what we do, we have the power and the strength within us to stand up, to raise our voices. The hardest things to do are often the right things to do. So once we realized that we had this population level lead exposure, the focus shifted to what do we do next? We failed at this concept of primary prevention, which is what you're supposed to do for lead and trauma. You're supposed to, because people are never supposed to be exposed to bad things. But once they are, what we're supposed to do is something called secondary prevention. What can we do to mitigate the impact of the crisis so we don't see all those damning consequences? And that was the immediate response. Stop the exposure, make sure people know that there's a crisis and have alternative sources of water. That was the first thing. But then we took a long view. And that's the work that we have been doing, throwing everything at our children and families, from high quality childcare. We have 2 brand new childcare centers, literacy programs, breastfeeding support, home visiting programs, trauma-informed care, mental health resources, nutrition services. It's all weaved together through an effort I run called the Flint Registry, which is supported by the Centers for Disease Control, the CDC. So the Flint Registry has been able to voluntarily enroll over 20,000 people. We've made over 30,000 connections to different things like Medicaid expansion and home visiting programs and mental health resources and developmental supports and pipe replacement. So the list goes on. And that registry will hopefully continue to do this work for decades to come, because when you understand the science of lead and trauma, you can be exposed to something as a kid, but the symptoms or the consequences may not manifest for years, if not later. We eventually went back to Great Lakes water within really a few weeks. But the damage had been done to our pipes. So the pipes have to be replaced. And that's the process that we have been in. It took a while to get funding from Congress to replace those pipes. We also had state dollars. There was a lawsuit that mandated it. So where we are right now in Flint is almost done replacing our lead pipes. Because we are not done replacing our lead pipes, there is not an all clear on the water. Our water quality is absolutely much better. It is within compliance of all federal standards. But whenever you do infrastructure work, whenever you are digging in the earth, you have the potential to disrupt lead scale. So because of that pipe replacement work that is still happening in the city, that is the reason that there is still kind of the precautions or the recommendation to use filter water or bottled water. The most common question I get asked is, how are the kids of Flint doing today? And that's what we've been trying to answer with the Flint Registry at a very population level. And what we were finding is that, yeah, kids are struggling. They're struggling with attention issues and learning issues and health issues and mental health issues. Is it because of the water crisis? I don't know. And that's the hard thing with most environmental exposures. It's very difficult to prove causation. And in a sense, I don't care because I want to see how kids are doing, and I want to support them. And over time, I want to pick up things early, get them connected to resources. At a population level, yes, folks are struggling. Is it because of the water crisis? Is it because of the water crisis atop of all these other injustices and inequities? Probably a combination of both. But most importantly, we're trying to treat all of that. In Flint, there's literally a 15-year difference in life expectancy between a kid in Flint and a kid in another part of our county. Once again, this is not unique to Flint. This is throughout our nation, where things like your census tract or your zip code are greater predictors of how you end up because of the environment, the milieu of your upbringing, rather than anything in terms of your potential. Flint, once again, the poorest city in our state, it was poverty that got us into this water crisis because we were taken over by financial emergency managers. We remain a poor city. We should not think that kids can shoulder all these burdens and be resilient and overcome these insurmountable obstacles. What we should be doing as a society is to build more resilient communities, to buffer children from all of these adversities and toxicities. And that's what we're trying to do in Flint. So we launched a program called RX Kids. It is a prescription for health, hope, and opportunity. Every pregnant mom now in Flint and every baby in Flint gets unconditional and universal cash prescriptions. We can create the situations, the environments, the milieu where kids can just be kids. We want Flint to be remembered for what we have been able to do next and how our best practices have really helped kids and communities everywhere.